Hundreds of thousands of surgeries are performed daily, whether they be for cosmetic, pain-relieving, or even life-saving purposes. Surgery, or more specifically the treatment of individuals through incisions with specialized tools, has been a concept for centuries. The environment we are used to today, sterile and filled with bright lights and trusted professionals who have gone through years of training, was unimaginable years ago. And of course, the pristine, sanitary, and efficient methods that come along with hospitals in our modern society didn't always exist. There is a long history of how surgeries originated and developed over time to reach the level of technological advancement we have today. The first surgery was performed in 600 BC by an Indian surgeon named Sushrita Samhita. He performed a plastic surgery operation in which he completely reshaped the nose of his client. This was the birth of the infamous rhinoplasty nose surgery, whose ways are still used to this day. Samhita also discovered the otoplastic technique for reconstructing an earlobe with the skin from one's cheek. Considering the time period, surgeons of this day are impressed by his knowledge and ability to come up with such brilliant and life-saving ways. Because there were no forms of anesthesia back then, Samhita emphasized that wine should be given to the patient in order to intoxicate them and suppress their sense of feeling. It still remains a mystery to this day of how so many patients survived such invasive surgeries without proper anesthesia. Students following in Samhita's footsteps were expected to go through training for at least 6 years and were taught numerous techniques on objects, including fruits and vegetables. These methods are still used in many pre-med workshops to this day to teach the ways behind stitching, as well as making proper and clean incisions on human skin. Unfortunately, even with this training, in the many years that would come, surgeons following in Samhita's footsteps didn't always take the precautions that he did. His knowledge was preserved for decades in the Sanskrit language, which prevented its translation and added to the disconnection in medical treatments in the decades that would follow. All over the world and spanning across many years, medical treatments advanced in different ways. Firstly, the Egyptians are often recognized for their methods of surgery compared to the times, but in reality, their techniques were quite gruesome. Egyptians learned the most from their famous mummification processes in which they removed the internal organs of their people and preserved the bodies in cloth and honey. They were also the first to make bloodletting a popular phenomenon in which it was believed that if an individual was ill, it was because he or she had too much blood. Sicknesses from sore throats to the plague were treated with splitting a vein open to drain blood. Fast forward to the Renaissance period in Europe, surgeries many times was seen as art and entertainment more than just for the purpose of treatment. Because of the lack of anesthesia, performing a surgery was quite gory and was viewed as a public spectacle. Known for performing over 4,000 public surgeries, Frère Jacques was credited with much fame and popularity, even though the entire concept was quite barbarous. Chinese alchemists, on the other hand, viewed mercury as their prized possession and swore to its supposed life-saving and lengthening properties. Little did they know mercury would be more harmful to the human body than performing a surgery at the time was. Patients often died of liver damage because of the mercury poisoning, and autopsies of the body didn't reveal its true harm until many decades later. Through trial and error, advancements were made in the surgical field not only through the development of anesthesia and better tools, but also through the discovery of the importance of sterilization. For decades, it was unclear that a surgeon washing their hands before surgery was just as important as washing them after the procedure. Something as simple as cleaning their hands helped to contain the rapid spread of bacteria that otherwise manifested and killed exposed patients. Through other safety precautions as well, mortality rates dropped drastically, and many more were able to survive these invasive operations. As time progressed and we reached the 20th century, surgeries had become quite successful and efficient. The first open-heart surgery was performed in 1893 by an African-American surgeon by the name of Dr. Daniel Williams. The surgery involved the sealing of a palpitating gash near the right coronary artery of the heart. This was a groundbreaking moment in history because not only was the surgery performed by a Black individual who was still at the time fighting for complete equality, but the patient lived a healthy 20 more years post-surgery. Later, during World War I, the industry saw tremendous innovation through mobile surgery techniques. Doctors carried all sorts of equipment in trucks and roamed battlefields treating wounded soldiers. X-ray tubes also became common during this time of the 30s, and the technology aided doctors in being able to view the inside of the patient's body before operating. The following decade brought tremendous innovations, such as lobotomies, which is a life-saving technique of cutting the prefrontal cortex of the brain in order to cure diseases such as schizophrenia and depression. By 1970, laparoscopies had become a new and safer method of surgery. Instead of making large incisions in the body, which posed a much greater risk of infection, doctors were able to invent a way to insert a small camera into the body through a smaller incision and treat the patient in this manner. These techniques are often used still to this day. Just within the last few years, cutting-edge technologies have begun to rely less on the skills of humans and more on robotics. The Da Vinci surgical system, made by Intuitive Surgical, could in the near future allow physicians to work remotely on patients from all around the world. The future is very bright for surgery and has a lot of potential for new ways to cure illnesses. Thank you.